As common as it is, depression tends to go unnoticed, especially in teenagers. You may not know it, but you probably have friends who are depressed. They don't seem depressed by how they act at school or what they post online. But what you see on social media or in real life are usually the things they want you to see. That's because we would much rather show our best selves to the world, even if it means hiding our troubles. Let's back up. What is depression exactly? Depression is a mood disorder that is usually caused by a combination of genetics and environment. The causes of depression vary from person to person, and a family history of depression, negative life events, racism, discrimination, substance use, and chronic illness are some factors that put you at higher risk. What are the symptoms of depression? Perhaps you've lost interest in your favorite sports, can't focus on schoolwork, or don't have the urge to eat. You might be in a good mood one moment and in a foul mood the next. Or maybe you are getting along with someone just fine, but the next day, they are getting on your nerves. Or perhaps you are much more irritable than usual. Maybe there are periods when you feel almost normal, like when you're with friends, but the symptoms return behind closed doors. Ask yourself, have I experienced a drastic change in mood, interest, weight, appetite, sleep, concentration, or energy? Having symptoms doesn't always mean you have depression. 3 other factors play a role. The duration, how long have you been feeling this way? The frequency, how often do you feel this way? And the impact, how are these symptoms affecting your life? If your symptoms occur often or last long enough to interfere with your life, whether it's your grades, activities, or relationships, talk to your parents, caregivers, school counselor, or an adult you trust about how you're feeling. Your family might not know about your problems unless you open up to them. If you or your family think you might be depressed, the only way to know for sure is to see your doctor as soon as possible. If you are having thoughts of death or self-harm, tell someone right away. Please don't wait to get help. Depression is not a bad word. When you ask for help, depression can be addressed and treated. And you can go back to feeling like yourself and doing things you enjoy. How can you treat depression? When you meet with your doctor, they will review your symptoms and talk about treatment options with you. Depression looks different in different people, and treatment will vary depending on what you need. Depending on how you're feeling, they may recommend counseling, medication, and/or advise you to see a mental health professional to help guide your treatment, which may include therapy. There are a few different styles of therapy they may recommend. Cognitive behavioral therapy, or CBT, is about learning skills to handle emotions, modify thought patterns, and shift behaviors. Interpersonal psychotherapy, or IPT, teaches you how to improve relationships through better communication. Family therapy helps to foster positive interactions between you and your family. Supportive therapy offers ways to talk through problems and how to solve them. Some people need a combination of counseling, therapy, and medication. Treating depression is not one size fits all. So work with your family and doctor to find the treatment plan best for you. Remember, you are not alone. There are people out there who understand how you feel and how you can heal. If you are considering suicide, you need to seek help right away. Tell your parent, caregiver, or trusted adult immediately. Go to the emergency room or mental health crisis center. Call or text 988 to reach the Suicide and Crisis Lifeline. With the right help, better days are within reach. Please don't wait.